Hello, welcome back to today's video. Let's talk about prostate cancer. What is prostate? The prostate is a gland in men. It's not found in women, okay? That makes part of the fluid in semen that transports and nourishes spermatozoa. It is found under the bladder in front of the last part of the large intestine called rectum. Prostate cancer is one of the most common types of cancer. So, many prostate cancers, they grow slowly and are confined to the prostate gland and may not cause serious harm, while some prostate cancer too can be aggressive at the same time and spread quickly. So, however, as the tumor enlarges the prostate gland, one may have the following symptoms, okay? But there are usually no symptoms in early prostate cancer. So what are the symptoms of prostate cancer? One, there is difficulty starting urination, okay? People with prostate cancer, when they want to urinate, they always find it difficult to start urination. Then there is decreased force in the stream of urine. Normally one's supposed to be able to urinate freely without having to force that urine to come out. So people with prostate cancer, they always experience that decreased force in the stream of urine. There is also painful urination in people with prostate cancer, okay? There is also weak and interrupted urine flow, like when they are urinating, they will urinate, it will stop a bit, they will urinate, it will be cutting. It won't be that free. It's also one of the symptoms. There is hematuria, that is bloody urine. When you see that urine, it always looks bloody. So it's also a sign of prostate cancer. There is also blood in semen. Like if you look at the semen that they produce, is always bloody. Is also one of the symptoms of prostate cancer. There is erectile dysfunction in people with prostate cancer. There is also bowel incontinence. There is bone pain. They might also experience leg or feet numbness, okay? There is also weight loss, lower back pain, hip pain, chest pain. All these are symptoms of prostate cancer. There is also frequent and sometimes urgent need to urinate, especially at night. So all these things I mentioned are the symptoms that are common in men with prostate cancer. So what is the cause of prostate cancer? The cause of prostate cancer is not yet clear, okay? So the prostate cancer begins when cells in the prostate develop changes in the DNA. So what are the risk factors of prostate cancer? The first risk factor is age. So one have the risk of having prostate cancer as he increases in age, okay? So it's always common after the age of 50. So but once you are 40, mid 40, getting close to 50, you start monitoring this prostate enlargement, okay, to avoid hitting that particular age that it will now start enlarging beyond control, okay. Another risk factor is race. According to the research I made, black people have a greater risk of prostate cancer than other races. I don't know why. So that is what I discovered from my research. Then another risk factor is family history. If a blood relative has been diagnosed with prostate cancer, one risk may be increased. If your dad or your brother have been diagnosed of prostate cancer, there is tendency, but it's not like you must have it, okay? Just that is a risk factor. There is tendency that the person might develop prostate cancer in the future. Another risk factor is obesity. People who are obese may have a higher risk of prostate cancer, okay, compared with people with healthy weight. So another risk factor is smoking. So we have seen the symptoms and the risk factors of prostate cancer. So what are the complications now? The complications of this prostate cancer is that cancer can spread, okay? Prostate cancer can spread to nearby organs such as the bladder, because it is very close to the bladder, or it can also travel through bloodstream or lymphatic system to bones and other organs. So you can see that this cancer can travel through the bloodstream, because if you can remember in our symptoms, we also have bone pain. So when they travel through the bloodstream or the lymphatic system, they can travel to the bones, okay? Then another complication of this prostate cancer is urinary incontinence, okay? Erectile dysfunction. All these things, they are things that can come up while one is battling with this prostate cancer. So how do one prevent prostate cancer? One, you have to choose a healthy diet full of fruits and vegetables. Eat a variety of fruits, vegetables, and whole grains. Fruits and vegetables, they contain many vitamins and nutrients that can even contribute to your overall health, not only to prevent prostate cancer. Also choose healthy foods over supplements, okay? Because when I researched, I saw that there is no studies that have shown that supplements play a role in reducing this one's risk of prostate cancer. So choose foods that are rich in vitamins and minerals so that you can maintain healthy levels of vitamins in your body, okay? Another way to prevent this prostate cancer is to exercise regularly, okay? Because exercise generally improves our overall health, okay? Then also maintain healthy weight. If you have been watching my videos, you will notice that whenever we talk about risk factors, obesity is always one of them. So it can tell us the importance of maintaining a good and healthy weight, because once someone is obese, it can bring in a lot of illnesses too. So always maintain a healthy weight. So if you need to lose weight, okay, because there are some people that when they want to lose weight, they do things that can even cause them more harm. So when you want to lose weight, it's good to see your doctor, okay? They will help you to create a plan for healthy weight loss. Then we are now done with the complications, okay? So what are the diagnoses? How do we diagnose this prostate cancer? We have a screening test called PSA, which means prostate specific antigen, okay? So when this test is being done, it will tell you the level of your PSA, okay? So the prostate gland, they make a protein called protein specific antigen. So elevated PSA may indicate prostate cancer, okay? And also rise of one, that this thing is also high does not mean that it's only prostate cancer that can make your PSA to be high. Prostatitis can also make PSA to be high, BPH2, benign prostate hyperplasia. I don't know if I'm getting the right forming of this BPH. So it can also make prostate specific antigen to be high. So PSA is the screening test. Then there is also digital rectal examination. So doctor can examine your rectum to see if there is any hard areas, okay, that could be detected. So these are the things that you can do to examine whether the prostate gland is enlarging. Then what are the possible treatments for prostate cancer? Treatment often depends on the stage of the cancer, okay. Men with prostate cancer, they have many treatment options. So the treatment that is best for one man may not be best for another. So the options, they include active surveillance, where the patient will always be visiting the doctor to monitor the growth of the prostate cancer, the prostate gland. There is also surgery, okay. Radiation therapy is there to shrink and kill the cancer cells. There is also chemotherapy and immunotherapy. Hormonal therapy can also be used in the treatment of prostate cancer. So this is the end of our video. I believe that we have learned one or two things about prostate cancer. Once you are a guy and you are 40, okay, start checking your PSA level. It is very important, because when prostate cancer is being detected earlier enough, treatment is possible. Thank you so much for this quality time that you have spent with Tessitoni. See you in my next video. Bye for now.